I would like to welcome you to the first discussion session for the GeauxConsumerLA Health Initiative. We are very excited to have this project and to have the speakers that we have lined up. You can go to the website to learn more about GeauxConsumerLA Health Initiative. I have the link there. It'll also be in the video upload when we put it on YouTube. Just some basic information. It is an international educational program that provides free, short, on-demand consumer health for the librarian, information professional, or staff with an interest. If you finish a minimum of 12 hours, including the class Beyond an Apple a Day, that can be a part of the 12 hours, then you can apply for the Consumer Health Information Specialization, either a level 1 or level 2, depending on how many hours you do, through the Medical Library Association. Credit for these discussion sessions will be obtained after completing the project evaluation and after the MLA evaluation, where you will attest that you completed the pre-session reading and watched the session. Those in Louisiana may also be able to have the fee waived for the Consumer Health Information Specialization if they follow the appropriate steps listed on the website. So if you want more information, once again, there's the link to that. Here's our project website, and you can find details about the project, other details about filing for credit, and also the primary courses are listed. Everything will be archived. This is all meant to be on demand, so you can go on at any time and watch these videos, then take the assessments and claim credit. We also have the the discussion group offerings, which today is our first one, and these will also be archived and have all the materials online so that you can watch them at any time. We'd like to thank the National Networks of Libraries of Medicine South Central Region for providing the funding through a National Library of Medicine funding award. And if you want to find out about them or find your own region, you can go to the websites listed here. So I was very happy to have Terry Davis, Dr. Terry Davis, to be our first speaker. She is part of the reason why I work at the institution I work at. I found her work to be absolutely fascinating and wanted to work at the same place she did. She is a major leader in the health literacy in the United States, probably worldwide as well. She's been doing this work for over 25 years, and she has done some major work as far as involving the rapid estimate of adult literacy in medicine, which is the REALM test, which has been translated into many languages and is a very user-friendly patient education test that you can do to formally assess patient literacy levels. She's also done an amazing job with developing patient education materials for a wide group of organizations. Number one being the American College of Physicians Foundation. She also was a member of the IOM Committee on Health Literacy, which is now the National Academies, and she's still involved with that. She was involved with Healthy People 2020, and she has just been a major investigator involving health literacy, especially in oncology issues, colorectal cancer, breast cancer, and she's one of the first people to organize an 8-institutional project with clinical and translational science to promote health literacy within Louisiana. If you want to read her bio, I highly suggest it. If you have not read, and read her papers. They're excellent. And so now I'm going to pass it on to Dr. Davis.
So librarians, I'm very excited to talk to you today. We're going to talk about health literacy and improving health communication. The cartoon says that it's the doctor saying, I better be health literate after giving the best years of my life to medical training, and the patient says, right, but can you explain any of it to me? And I think the librarians are key in doing this. Last year at an IOM meeting, I interviewed the Deputy Director of the National Library of Medicine, Betsy Humphreys, and she says she thinks librarians will be increasingly important in health communication because they are accessible and they're trusted. And she thinks she'll be more and more important in health communication. So why should librarians focus on health literacy? It is increasingly important as health technology is changing. I mean, the technology of librarians has changed tremendously in the 37 years I've been on the faculty. The card catalog is gone. Health technology, healthcare delivery, health research are changing so rapidly and bringing new communication challenges to patients and providers. And I think medical librarians and public librarians can be a helpmate to all of us. Nearly 9 of 10 adults have a hard time using health information that's routinely available in healthcare facilities and in the media. Clinicians and researchers often fail to grasp the gap between what we want to communicate and what patients actually understand. And that's where I believe librarians can come in. The other thing is that the demands and expectations of patients and research subjects are increasing, and health-related decisions are becoming more complex. One of the complexities is now insurance that everybody must have, and it's overwhelming to many. More and more things are done with health technology. You go to a doctor's office and you might be given an iPad. So things are changing rapidly. And also, there's a lot of boom now in medical research. We want to do genomics research, biobanking, and there are disparities in recruitment and trust in clinical trials and biorepositories, particularly among people with low income, low health literacy, minority groups, and those living in rural areas. And the reason that's important is a lot of our drugs and treatments are based on research. They're all based on research that's been done previously. But a lot of the research that had been done previously is with white men in urban areas, and that might not be appropriate for treatment and drugs for all the rest of us. So the definition of health literacy is the ability, which is in the National Library of Medicine. Health literacy is the ability to obtain, understand, and use health information and services to make informed decisions. There are tons of articles that link low health literacy to poor health outcomes. It's linked to worse understanding of consent for procedures and trials, poor ability to interpret food labels and medication labels and health messages, worse ability to take medication properly, less likelihood of receiving preventive care and so getting a delayed diagnosis, poor knowledge, competence, and skills to manage chronic disease like diabetes, poor physical and mental health, more use of the emergency room, avoidable hospitalization, and that readmission swinging door that's such an important issue in healthcare now. And it's related to increased disease-related complications and mortality. The NIH, National Institutes of Health, these are their views on health communication. We can't blame people for not understanding information that we're not making clear to them, and that's where you guys come in. Everyone, no matter how well educated, is at risk for misunderstanding health information if it's complex enough or emotionally charged. In most cases, physicians try and believe they are communicating understandable information, and patients may believe they've understood it, or they may be embarrassed to ask your questions. They know doctors have limited time, and they don't want to slow them down. Also, this is another place that y'all are going to be increasingly important. It is really hard for people to separate evidence-based health information online from misleading ads and gimmicks. On TV all the time, there's all of these commercials for cancer centers, every drug for everything. Some of these cancer drugs cost $10,000 a month and may increase your life a few weeks. The evidence for what's being advertised on TV is often not there. Also, in teaching medical students this week, I asked them, what are your communication challenges? And they said increasingly it's people who speak Spanish. And I wanted to share this with you because I wonder if Spanish speakers are coming into the library. 18% of U.S. households speak a language other than English at home. There are 54 million Latinos in the United States. This is second only to Mexico. 18 million of them do not speak English very well, and so their health literacy is lower than people in the United States. In a study at University of California, San Francisco, 63% of limited English proficiency patients understood instructions from a provider who spoke the same language, and about a third understood instructions from an interpreter. So this is a challenge that we all face. What is literacy? Well, the definition and the requirements change with the demands of society. During the Civil War, being literate, and they only tested white men then, was being able to sign your name. In World War I, you needed a third grade education. World War II, you needed to finish grade school. War on poverty, they said everybody needed an 8th grade education. Now, to be in the service, the military service, you need a high school degree. So literacy is more than reading. It's writing, the ability to communicate orally, math skills, which are very important and Americans are terrible at, the ability to problem solve, your judgment and interpretation, and in the next national health literacy and literacy surveys, they will add internet skills. I'm not sure when that's coming out. It was supposed to be last year. I don't know the funding for that. But you need these skills in order to function on the job and in society. So there was a national literacy survey, and they tested 19,000 U.S. households. They knocked on the door. And of all the questions, there were 54 questions that related to health. They related to clinical aspects, preventive aspects, and navigational aspects. No person got more than 8 health questions. But from that, they were reporting what is a national assessment of health literacy. Now, it is interesting that this pie graph shows that they scored it on below basic, basic, intermediate, and proficient. The numbers in parentheses are their math skills, the numeracy skills. But the reason they scored it like this, the below basic, the red, the literacy people and the national education people wanted to know how many Americans did not have the basic literacy skills to, for instance, enroll in a GED class. These are people reading a 3rd or 4th grade level. And what they found out is when they looked at the health-related items, that 14% of people had below basic literacy and 22% had below basic numeracy. And these percentages are double or triple for minorities and people 65 and over. The pie graph also shows you where the average Medicaid recipient is, the average high school graduate, and the average American. So most Americans are in the low intermediate range. Well, what in the world does all that mean? Well, they were very easy scores. You only had to get 67% right to say that you had those skill levels. But people in below basic, you had to have a 67% probability of circling the date on a doctor's appointment slip. In intermediate, this is what's really important. You had to be able to determine what time to take prescription medicine based on the label. And you had to have proficient skills to calculate employee share of health insurance costs using a table. Tables are very difficult for people, and graphs for people with limited literacy. So how can you tell? I want you to think as a librarian, what are the red flags for you? These are red flags for physicians. Patients often say, I forgot my glasses, I want to discuss this with my daughter, incomplete intake forms, frequently missed appointments. You got to figure out to schedule where to be at what time and know how to navigate the system to be able to get there. Unable to give a coherent sequential history. People with low literacy tend to tell stories. Not taking the medicines correctly, asking fewer questions. You have to have the self-confidence and vocabulary to ask a question. And sometimes patients will ask or tell doctors they don't understand, but then if they still don't understand, they're not likely to ask again. Lack of follow-through with referrals is another big problem. This study was done at Vanderbilt, and it shows the hidden problems with numeracy. This is a soda pop label. And so they asked patients, you drink this whole bottle of soda, how many grams of carbohydrate does it contain? Well, it contains 67.5. How'd you know that? Well, you looked up and saw 2.5 servings per container and the total carbohydrate, and you multiplied that in your head. But look, only a third of the patients answered it correctly. And who are these patients? 3/4 had private insurance. That tells me they've got a job. 2/3 had at least some college. About 80% read above a ninth grade level, but only about a little over a third scored above a ninth grade level on a math test. Percentages and probability, which I've been talking about, are challenging for many people. Only half of U.S. adults can calculate a tip. I love this tip. So dinner is $23.54, the tip is 5 something, the total is 29. So I wonder how many waitresses and waiters get a tip like this. 20% of college-educated adults in the U.S. do not know what a higher risk is. 1%, 5%, or 10%. And the U.S. adults score below most industrialized nations in numeracy and problem solving. So if you're working with a patient and it involves calculation of food labels, people are terrible with food labels. They can't handle them, and the FDA knows that, and they're trying to figure out something else. But a lot of times if you're diabetic, the diabetic educator will want you to have a half a cup or a third a cup or so many cc's. And medicine labels are like that also, and they're very confusing for people. Risk communication is very confusing, and we teach doctors to give both positive and negative frames. 6 in 10 men who have surgery to treat prostate cancer will be impotent. This means 4 in 10 will not. Also, it's also very important to give absolute rather than relative risk. Drug X could reduce your risk of breast cancer by 50%. Good grief, I want that one. But if you put it, drug X could reduce your 5-year risk from 4% to 2%, that is not as powerful. And that's where you see some TV going a little awry. So how can you and we as providers improve our health education? Slow down. We need to focus on the patient and what they need to know and do. Avoid medical jargon. Use living room language. I bet y'all are pretty good at using living room language, plain language, understandable language. Attend to patients' culture and their family. Use pictures, pamphlets, their medication bottles to go over the medication with them. Limit information. The more doctors tell people, the more they forget. I teach doctors to write brief take-home information. What's my problem? What do you think I should do about it? And to tell them what the benefit is. You also have to tell them, the doctors need to tell them why it is in their best benefit or their baby's best interest to do that. Repeat and summarize information. You will not know that the patient has understood or can act on what you've said unless you teach back, ask them to teach back or show back what they understood or what they're going to do. Also, it's really important for doctors to be positive and motivating because the patient's the one that's got to do this. So is this a duck or a bunny? what do you see? Many people see a duck, other people see a bunny. Well, it's really a duck and a bunny. But the important thing, the reason I'm showing you this duck bunny, is if the patient is interested in a duck and you think the bunny is more important, it's important for you to see that everything is really a duck and a bunny. You've got to give the patient what they are asking for, as well as maybe something else that they may have missed. But the benefit of being the librarian, the patient has asked you for something. That is a great window of opportunity to give them information that will be truly useful for them. Pictures are great teaching tools. And remember I said we're not good with measurements. And so this healthy plate shows you that you need to eat. Even patients with very low literacy, when I said, what are we trying to teach here? They said, well, you need this much meat, this much starch, and this much salad or vegetables. So they can get it and you can remember it and you don't have to think about a half a cup or 4 ounces. A potato the size of a computer mouse, a serving of steak is the size of a deck of cards, and a serving of rice to Louisiana people is this much, a teacup size, rather than a whole plate full. I think it's important that librarians be able to evaluate health information. And this is what I teach patient educators. To look at information you use, always read the information before you hand it to somebody. Is the message obvious on the cover, the title, and the headings? This is about the American College of Physicians want us to do a patient guide to obesity. Now, nobody's going to pick that up. But we entitled it, Make It Happen, Helpful Ways to Lose Weight, Everyday Guide for You and Your Family. And we use real people. Does the pamphlet get to the point quickly? That's what everybody wants, get to the point. Our key message is easy to pick out. One of the problems with health information is often the key message is buried. Can the reader easily find what they need to know and do? That's where you come in. Is information actionable? Can they use it? Can they act on it? Can they do something with it? Is it too much? Is it overwhelming? Is it culturally appropriate and language appropriate? We developed these books in English and Spanish. When you're looking at materials, you need to consider the reading level. Now, the average education level of U.S. adults is 12th grade or above, but the average reading level is about 8th grade. And materials should be aimed at less than 8th grade. Now, the reading level is just the tip of the iceberg, and it's sort of a common myth that the government has said it has to be under 8th or it has to be under 6th. The government never said any of that. What they said, there was in 2010 a plain language law that materials, health materials, and other supposed materials by the government needed to be written in plain language. And I know Cynthia Bauer, who was previously at the CDC, is going to talk to y'all about clear communication and health language. She's done a lot of work on this, so y'all are lucky to be able to have her. One of the easiest ways to assess reading level is on your computer, and you can get a Flash Kincaid electronically and not have to type it in. And down here it will give you the number of passive sentences you want active, the reading level, and let me tell you something, there are about 40 reading levels, readability levels. It's not rocket science. It's the length of the sentence. You need to aim for about 10 words. The length of the words and the complexity of the words and the density of the paragraph. So, but it's good to aim for under 8th grade. Checklists can be helpful because readability is just one indicator. So you need, as the librarian, to think, is it written in plain language or is it a bunch of jargon? Do they use consistent terms throughout? Is it written in passive voice, your signature versus signature of the patient? Is it formatted for reading ease? Is it too long? Is the information manageable or is it overwhelming? A lot of times if you're given text that's single space, it's very dense, people don't even try to read it. Think about the emails you get. You're scanning it. What do I need to know? What do they want me to do? What is the plan for discussing the information with the patient? So I wanted to tell you about the PMAT, which is the Patient Education Material Assessment Tool. Because readability is just the tip of the iceberg, you got to think, is this material suitable? And this is an evidence-based framework to help you see if it's understandable and actionable, and you can do it for print materials and audiovisual materials. So for instance, how do you assess understandability according to the PMAT? They say you ask yourself, if I were a patient unfamiliar with the subject, does the material make its purpose completely evident? Does it present information in a logical sequence from the patient's point of view? Do they use informative headers, bullets, boxes? People have an easier time with list of things, with bullets. You want to highlight something, put it in a box, color it. Is the information broken up into chunks, chump and clump it into short sections? Does it provide a summary? Actionability, does it tell at least one action and explicit steps to take? So these are just some ways that you can use to help identify if something is helpful. You know, one of the things years ago is evaluating early materials from the CDC about childhood immunization, and it was not presented in a logical sequence that parents wanted to know. It was all about the diseases. They wanted to know, what baby shots does my baby need to get, and when do they get the next one? And they didn't know words like immunization. They knew words like baby shots. So the American College of Physicians self-management guides are a great example of easy-to-read materials in English and Spanish, have lots of pictures of real people. They were developed by LSU, by University of North Carolina Medical School, and University of California, San Francisco. And they were developed with input of patients and providers nationally about what is the need to know and do, whether you want to lose weight, you're living with diabetes, caring for your heart after heart surgery or stent, living with COPD, or have rheumatoid arthritis. One of the things I like about these books, at the end of each chapter is a you can do it page that says it's not about giving up everything, it's about making little changes you can live with. Choose one of these easy ideas or write down one or two things you will do in the next few weeks. I'll eat breakfast every morning. I'll not eat seconds at dinner. I won't supersize, etc. The other thing I think is important, and a lot of healthcare systems are misinformed about this, is user-friendly doesn't mean dumbed down. The bottom picture is of instructions for a stool kit, fecal occult blood test. The top is simpler instructions. Everybody likes simpler instructions. If you're going into the bathroom to do a stool test, which one of these instructions would you take? There have been lots of studies that adults with high education and income still prefer brief, to-the-point material. Patients are looking for, what do I need to know, what do I need to do? If they want more detailed information, you can give them more detailed websites, because there are a ton of those. Also, websites need to be accurate, easy to navigate and understand, and that's where you can be helpful. Another common misconception is, let's just do a YouTube or a videotape. Well, if you can show people something, that is helpful. But these are often too long. People won't look at them if they're more than like 2 or 3 minutes. Also, you'll pick up a piece of paper and look at it, particularly look at the pictures, and particularly if it's in color. But if you have to stick something, if you have to go to a link to see something or stick a tape in, you may not do that. Too many health materials, the videos, are talking heads of doctors that are incredibly boring. and they're organized using a medical model, not a patient-centered focus. Focus on the patient, not the disease. Also, whether it's written material or video or YouTube or whatever, you need to attend to tone and the patient's emotion. How does it land on the patient? Who will show it? Where? What's the teachable moment? One of the things, now there's little studies on the efficacy of using multimedia over print, but I've seen some really cool cartoons that are not scary, created through the patient's perception and their perspective, that I think are showing promise. I called the National Library of Medicine and talked to a colleague of mine on the Health Literacy Roundtable, and he is Rob Logan, communication research scientist, and I said, I told him about this talk. He was very enthused about this. What are some helpful links for them? And he gave me several, and these were the the ones he listed first. The others that he listed are listed in this slide set under resources. Also, another really good resource that I suggest is the videos that we made of patients. They're not a talking head. They're interviews of patients who are demonstrating what it's like to be confused and what it's like to easily misunderstand and make mistakes. Julie, and her team who developed this series, also suggests this website for you guys. So the other thing is, people may come to y'all with questions about research, and research is growing and it will continue to grow. It is big data, multi-institution, and so consenting patients takes an increasing amount of time, sometimes up to an hour, and whoever is consenting a patient needs to be prepared and well trained. It's also difficult for people to understand all this data sharing. They are concerned about where their data is going, who will have access to them, who will have access to their biospecimens, which are just their tissue or their blood, but confidentiality is an increasing concern. Also, there's growing regulatory scrutiny, and funding agencies and drug companies are concerned, and the federal government's concerned about patient comprehension. What about research questionnaires? Nobody really pays too much attention to them about the literacy level. And patients struggle to independently read and answer them. They have trouble navigating the questions. They may not understand the stems and just check off the answers. Likert scales, which are either frequency or intensity, like frequency is the bottom one, very often, sometimes. Intensity is the middle one. Disagree completely, strongly, somewhat, etc. These are difficult for people, and people with low literacy really struggle with Likert scales, and particularly if it's more than 3 or 4 or 5 choices. And if you don't get much information if you do a true or false or yes or no. So here's some bottom lines. Plain language health information needs to be accessible, actionable, and developed with input from patients. It needs to be easy to understand. Patients trust their providers, particularly their primary care providers, their OB, their oncologists, and they trust librarians. And they appreciate people that genuinely care about them, have an ongoing interest in them, remember their names, and offer support. Regular touch points, face-to-face or phone or text, improve satisfaction and health outcomes. I teach doctors, and I would encourage you to include a family member if it's possible. It's often very helpful. And an interactive approach invites engagement, problem solving, empowerment, and improved health outcomes. So my last slide is a question to you. How does this talk stimulate your thinking? I would love it if you wrote some things back to the organizers of this curriculum. And what are your ideas of how librarians can help people improve knowledge, confidence in obtaining, understanding, and using health information? So that's all I have for you, and I commend you on signing up for this program.
Thank you, Terry, for the talk. It was very good. I just want to encourage you, if you've watched this discussion, to go out and pass the word on to public librarians, school teachers, and anyone across the country or the world who would like to take these short, on-demand, free educational discussions. We have a lot of really exciting speakers lined up, and I think that overall this will be an excellent opportunity for people to gain some education that's very beneficial. If you are thinking about claiming credit, your first step is to go to this URL and complete the assessment. Please make sure that you have read the document that was the pre-reading and that you have seen the videos, because the assessment will have 3 questions that will talk about those things. And we're doing that just to make sure that people have read material as well as attended the webinars. So, other than that, if you have any questions, please contact me, and thank you for attending.